Welcome to the Infectious Disease COVID-19 Preparedness and Response Plan. Thank you for coming to Homestead Senior Care Annandale in Virginia.
The purpose of this presentation is to comply with the Virginia Department of Labor and Industry and our Governor Ralph Northam's COVID-19 Executive Order and subsequent addendum, which was presented in the end of July. Under guidelines from the Centers for Disease Control, the state of Virginia is requiring all businesses to present infectious disease plans to all of their employees. This will give an opportunity for us to review the infectious disease protocols we've had in place since early March. If you have any questions following this presentation, please reach out to the office at 703-750-6644. I would like to introduce our Director of Nursing, Laura McKay, who will continue with the presentation.
Along with my role as the Vice President of Nursing for Homestead Senior Care Annandale and the direct supervisor to our personal care aides, I have taken on the role of the head of our infectious disease response team. My job in that role is to deliver proper training of all of our staff, monitor the federal and state guidelines for updates and changes to protocols, ensure that we have plenty of personal protective equipment on hand to protect our employees, and make sure that Homestead complies with the Department of Labor and Industry requirements. One of the tasks required by the Virginia Department of Labor's Infection Prevention Plan is that every organization must determine the exposure risk to their employees. Exposure risk level means an assessment of the possibility that an employee could be exposed to the hazards associated with COVID-19 virus. Many factors you can see listed on the slide have to be evaluated to determine this risk. We determine the COVID-19 exposure risk of all workplace functions to ensure that we apply appropriate hazard controls, including appropriate training, equipment, and personal protective equipment, PPE, to protect our employees' health and safety. The next slide shows the different roles of Homestead Senior Care and the risks of exposure associated in each of those roles. You can see from this picture chart that was put out by OSHA and the Virginia Department of Labor and Industry, the jobs which are at the very highest risk of exposure to COVID-19 are healthcare employees that are performing aerosol-generated procedures. Those are things like suctioning a trach, working with clients that are intubated, doing testing for COVID-19, the nasal swabbing tests, healthcare lab personnel that work directly with virus particles, morgue employees, and those caring for known or suspected COVID-19 patients in the hospital type environments where there's lots of respiratory secretions being spread. Those at high risk are your healthcare and delivery support people, so your doctors and nurses working directly with COVID patients, your first responders, your medical transport people, mortuary employees, and other caretakers of people that are known or highly suspected to have COVID-19. You'll see in the next slide that our caregivers and employees are in the medium to lower risk categories of exposure. This slide lists all of the jobs within Homestead Senior Care's workplace and their exposure risk based on the functions associated with that job. So as you see, our office, administration, and finance people like Trupti, who does our billing and payroll, they're at the lowest risk because they work mainly independently in their office setting. They have little interaction with the public or other employees. On our client care side, which is the side that I'm on, recruitment and retention, which is Amy, and our scheduling department, Lane and Arlene, Aaron and I are both on the client care side. We have a medium risk because we do come in contact with the general public with other caregivers, new caregivers, prospective caregivers during the interview and orientation process. And as we know, with this virus in the community and with some level of asymptomatic spread, there is risk in a medium level when you come in contact with different people throughout your job tasks. You caregivers fall in the medium category as well because we are working with seniors who are isolating in their homes. They have in-home care to avoid having to be in settings like adult daycare settings and nursing homes, assisted livings where they would be at much higher risk. So are taking care of clients in their homes instead of working in assisted livings and nursing home environments. We're at a medium risk because our clients, our public interaction is with predetermined clients that do not have COVID-19 and are taking precautions to prevent themselves from acquiring it. Every business throughout the state of Virginia is required to have contingency plans in the event of an infectious disease outbreak. It is important to note that Home Instead Senior Care is an essential business. Being essential means that we work so our seniors can stay safe. Being essential carries increased responsibilities in our workplace and community. So it's important for us to have contingency plans for what would happen if some members of our care team were unable to work due to quarantine. Here's the plans that we have in place. Home Instead maintains an active and well-staffed scheduling department whose sole task is to both proactively and reactively address absenteeism, ensuring that all client shifts are appropriately filled. In a nutshell, that means that if Sally's daughter has COVID-19 and Sally needs to quarantine for 2 weeks, our scheduling department will place a substitute aide with Sally's client so that Sally's client and their family don't go without care. We also cross-train. So all our office staff members are cross-trained in roles within the company and are ready to assume another role if they're called upon to do so. Also, our caregivers have been trained to assist a wide variety of client needs, meaning a caregiver who does personal care might be asked to do a home helper companion client if the need arises, to fill in for a caregiver that might need to be out due to a COVID-19 concern. Our office staff members here in the office can do the same. So if Erin needs to be out, Lena or Lean might take over her role temporarily. We have ample supplies of PPE on hand, like gloves, surgical masks, hand sanitizer that are available for our everyday use, working in the field and in the office. We also have a vast supply of face shields, gowns, N95 and KN95 masks should we have to temporarily care for a client suspected of COVID-19. It is really important for you to know that all protective equipment that you might need for your job will be provided to you at no cost. I'd like to point out some things we've done within our office space in Annandale to keep you safe and keep our office staff safe. Under housekeeping precautions, our restrooms, common areas, doorknobs and door handles, desks, countertops, and any other frequently touched surfaces are disinfected at the end of each business day, and this is documented on our office cleaning card. The surfaces of any shared vehicles are disinfected at the end of each person's use or drive, and all disinfectants are EPA approved and otherwise comply with CDC disinfection guidance. To maintain social distancing, large gatherings in the office are prohibited. So unfortunately, since March, we have not had any in-services, caregiver appreciation parties, and our luncheons have all had to be postponed. 12 people is the maximum number that we have allowed in the office at any given time, as long as they're maintaining 6 feet of space between each person. Our office employees are maintaining a physical distance from each other and from visitors even when they're on their break. Employee workstations are kept 6 feet apart, and our masks are worn at all workstations when we're in the hallways, in the restrooms, and the common areas. They can only be removed when an employee is working in their own private office and the door is closed. Employee interactions with the general public have been modified to allow for additional physical space between parties. Inside our clients' homes, where you all work, we are requiring that you do things similar to what we're doing here in our business office. For housekeeping, we're asking that all caregivers disinfect frequently touched surfaces such as bathrooms, knobs and handles, medical equipment like walkers and the arms of the wheelchairs, countertops, things that you frequently touch or the client frequently touches throughout the day. And you do this at the beginning and the end of each shift. And document that you've done so in your journal log note. Caregivers should disinfect hard surfaces of their vehicles if they're using the vehicle to transport the client, beginning and the end of the client ride. All disinfectants that you use should be EPA approved or otherwise comply with CDC disinfection guidance. If you're unsure, please let me know. I can check the product for you. If your client who should supply the disinfectant product and paper towels does not have access to them, please let the office know. We have plenty here in the office that we're happy to supply to the client's home so that you can maintain your own and your caregiver and family safety. Additional precautions that we're doing. When you're in your client's home, please maintain a 6 foot of physical distance from the client, from other caregivers at change of shift, and from the client's family members or household members, except during the provision of direct care. You're to wear your surgical mask or a 2-layer cloth mask, that's your preference, throughout your shift whenever you're in the same room as the client or members of the client's household. And you're to wash or sanitize your hands at the beginning of each shift, the end of each shift, frequently throughout the shift, especially when you've come in contact with a potentially infected surface. I know we've all spent a lot of time educating ourselves about COVID-19 disease and how to prevent infection, but just to recap, there's some characteristics and methods of spread with the SARS-CoV-2 virus that we know. You can become infected by coming into close contact, about 6 feet or 2 arm lengths, with a person who has COVID-19. This is especially important because COVID-19 is primarily spread person to person. You can become infected with COVID-19 from respiratory droplets in the air when an infected person coughs, sneezes, or talks. You might also become infected by touching a surface or object that has the virus on it and then touching your mouth, nose, or eyes. You can become infected with COVID-19 and not show any symptoms, what we call asymptomatic. Remember, the most effective way to prevent the spread of germs is good hand washing, and this includes COVID-19. Remember, when you wash hands for 20 seconds. You can remember to do that by singing the happy birthday song 2 times. Masks are equally important in preventing the spread and transmission of COVID-19, and surgical masks and 2-layer cloth masks have about the same level of protection for the wearer and those in the community breathing the same air. So wear one of those 2 and we will happily supply you with paper style surgical masks. We're supplying them 8 at a time, but you may replenish your supply whenever you need it by stopping by the office during our business hours, which are 7 a.m. to 6 p.m. Monday through Friday, or when we're visiting your client, we can deliver them. Please read carefully through the next 2 slides, which go over the proper procedures for putting on and taking off a face mask and gloves. Let's take a moment to talk about what you should do if you are feeling sick or if you think you may have been exposed to COVID-19. You need to notify your office immediately. And remember, we answer phones 24/7. Notify us immediately if you display any symptoms such as fever, cough, shortness of breath, sore throat, new loss of smell or taste, any gastrointestinal problems including nausea, diarrhea, and/or vomiting. Even if you haven't been formally diagnosed with COVID-19, these are potential symptoms and need to be taken seriously. If you come in close contact with anyone that has been confirmed to have a COVID-19, or if you come in contact or live with any person that is displaying the symptoms we just discussed, you need to call your office immediately and do not go to your client assignment unless you are told specifically to do so. We do daily screenings electronically of all our caregivers to help you be mindful of how you're feeling, how the people in your life are feeling, and how your client is feeling. You'll see these daily screenings on your ClearCare Go mobile app when you get your shift reminder at 3 p.m. on the day before your shift. It is required that you complete the screenings and answer no to all 4 questions. If you answer yes, you should call the office or we will contact you when we see your yes answer to assess what's going on and determine whether or not you should remain with your client shift or be quarantined to take some time off. If you do need time off for illness or quarantine, your home instead nurse, myself, or our other nursing staff will advise you, and you will become available for paid sick leave through the Families First Corona Response Act, which provides up to 80 hours of paid sick leave, so you'll be paid for any shifts that you would have missed in your schedule because you are quarantining for COVID-related concerns. We have signs and posters in the office that notify you of your rights as an employee. And if you have questions about anything related to taking time off or paid leave for Corona issues, please feel free to talk to me or Trupti Patel, our HR manager. Here's a sample of the daily screening questions that you'll receive on your ClearCare Go mobile app and how that questionnaire works and how that information gets to the office. If you don't have the ClearCare Go mobile app, it's a great tool. Please call Amy and she will help you download it. If you do have symptoms that may be associated with COVID-19 or you have been exposed to somebody who tested positive, we will cover the cost of getting you tested, either through your medical provider or through our relationship with Progressive Primary and Urgent Care here in Annandale. They have rapid testing available 7 days a week, and you can make an appointment, generally get a same-day test, and the results are back within 20 to 30 minutes. So that's a great opportunity to really know what's going on and determine if you have acquired COVID-19 so that you can quarantine and take care of yourself and avoid spreading it to others. How do we know when someone has tested positive for COVID-19 when they can safely return to work? Well, the Centers for Disease Control allows for one of 2 strategies to be used for the workplace nursing staff to determine when you're ready to return to work. The first is called the symptom-based strategy. In order to qualify for the symptom-based strategy to return to work, the employee needs to have had 72 hours have passed since the recovery, which means that their fever is normal without using ibuprofen or Tylenol to bring down a fever. They have to have improvement in respiratory symptoms, so no cough or no shortness of breath. And it has to have been at least 10 days since your symptoms started and you notified the office so that we could get you tested. So 10 days have to have gone by since the start of your symptoms. If you've met all those criterion, our nurse here, myself, will determine that you are eligible to return to work. There is also a test-based strategy, and that strategy requires that you have a resolution of your fever without fever-reducing medicines and improvement in respiratory symptoms, so no cough or shortness of breath, and then you get 2 negative tests done, the same test that you got when you were diagnosed. You would get those tests repeated at least 24 hours apart, and if both those tests come back negative, then we have a great assurance that you are no longer contagious with the COVID virus. We have been using the test-based strategy and will continue to use that unless there becomes a scarcity of tests or the test-based strategy becomes too cost prohibitive. We are taking measures to minimize our exposure risks outside the workplace, and we require that you all do that with us. Things we can do, we have limited in the office our in-person meetings. We don't have vendors coming in without appointments. Prospective employees, prospective clients are coming in by appointment only. We've limited the number of customers allowed into the workplace at given time. We've taken preventive measures to reduce face-to-face contact. We've got hand sanitizer and surgical masks right at the front of our office for any visitors who come in that don't have one. We've got disinfectants so that we can clean work areas before, like our conference area. If somebody comes in and does something in the conference room, that whole room is disinfected before somebody else is brought into that space. When not working, all Home Instead employees, all of us here in the office, all of you out in the field are required to follow Virginia guidelines, wear a mask or face covering, and social distance whenever in public. We know that there's areas of the country that have far greater outbreaks than we have, and areas outside the country that also have a more extensive impact with the disease. So all employees are required to report to the office if they have traveled within or outside of the United States. So when you put in your leave request for a vacation, we're going to ask you where you're going and where you're going during your vacation or your time off, so that we can assess whether we need to be concerned about your exposure and potential exposure to your clients when you come back to work. So if an employee is returning from an area of concern, the employee may be required to be tested for COVID-19 or to quarantine from work for 14 days following return. We will discuss that with you each individually on a case-by-case basis, but our goal is to protect our clients and their families when we've gone to Florida or a place where there's high incidence. We have to have you tested before returning to work or have you quarantined. Thank you so much. This ends our presentation of our infectious disease prevention and planning. We'd be happy to answer any questions that come up. My email and phone numbers are listed below. This is a paid training and it is required. So we do ask that you go into your email and find the second document we sent with this PowerPoint. That is your certificate of completion. Click on it and do the DocuSign and send that back into us so that we can put a copy in your file and put an hour of pay in payroll for you. If you have any questions or problems with the certificate, please let us know. We'd be happy to help you through that process. Again, thank you so much. Stay safe. We're all going to get through this. going to be over eventually, and we're all praying for that day.